sign for, say, the carpal tunnel and the median nerve. You also want to be able to say how much of a sensory loss, especially if they're describing that their fingertips feel numb or they just don't feel the items that they're trying to pick up with their hand. So each of these monofilaments are of a different size, and this is a very uniform test. And so when I pull these out, first I sit there and say, I'm going to do a test now, and I promise you these are not needles. I swear, you open this up and patients' eyes sometimes get really big because they're thinking you're about ready to stick them. But what I'll do is, depending on if they've already described, well, it feels a little tingly, stuff like that, I may only open up a couple of them and kind of have the other ones in reserve. But they vary in the thickness, and that will tell me the difference in how much of a loss of sensation there is. So when you look at it, and they're color-coded, this is, again, uniform. The green one is the smallest of the monofilaments. This would be considered normal sensation to light touch. And what I would do is, so if we're dealing with the median nerve distribution, I'm going to sit there and I will do this with both arms, but I'd have her across the way. So she has her hands right here. And so if we're dealing with symptoms in the left hand, what I'm going to do is I'm going to ask you to close your eyes. And before you do them, I want you to feel this. I'm going to take this little monofilament, okay? It's not going to stick you as a needle, but I'm going to tap against your skin. Do you feel that sensation? Okay. So what I want you to do is I want you to close your eyes and I'm going to tap on your hands. And I just want you to tell me if you feel me tapping. You don't have to tell me where, but if you feel it. So then what I'll do is I'll start to tap, and I'm tapping to where I'm getting the monofilament to bend, okay? Be consistent on how you do it. That's all I can ask, is that sometimes they say, okay, wait till it bends and lift up and do it again. I will oftentimes just get a very light touch going along the nerve distribution, and whether or not the patient feels it. So with your eyes closed, tell me if you feel it. Now, watch that you don't get into rhythm. All of a sudden, they can start to test when you're starting to get into rhythm, and they start saying yes, yes. So I'll sit there, I'll do a little bit. Now check again. So I will wait to see if I'm going to get